All women make vaginal discharge, but especially in the reproductive age group, because they're making estrogen hormone, and estrogen hormone stimulates the production of what we call normal or physiological vaginal discharge. So normal or physiological vaginal discharge is made by the gland cells of the cervix, by the cells of the vagina, and by different glandular structures within the female reproductive tract, such as the Bartholin's glands, which are glands near the opening of the vagina that produce a secretion. Normal discharge is often clear or white mucousy discharge, and women notice a variable amount of it depending where they are in their menstrual cycle. For example, in the middle of your cycle, when your estrogen levels peak, you tend to make more normal discharge. When is vaginal discharge a problem? Vaginal discharge can indicate itself as a problem if it is a yellow or green colour, which can indicate infection. If it's blood stained, and that can indicate pathology involving the vagina or cervix or even the main part or body of the uterus. Or if it's associated with pelvic pain, it's associated with irritation of either the vagina or the vulva, the exterior skin, then that's discharge that needs to be further investigated. What investigations do you need if you have an abnormal vaginal discharge? You need to have swabs taken often, which are tests for infection. You may need to have a pap smear or a cervical screening test of the cells of your cervix. But you should have an examination to see why you are making abnormal vaginal discharge. The commonest cause of abnormal vaginal discharge are two infections, either thrush, which is a fungal infection, which is quite common, and 80 to 90% of all women will have an episode of thrush sometime in their lifetime. The other condition is called bacterial vaginosis, which means you have an overgrowth of normal vaginal germs because your vagina is at the wrong pH or acidity. A normal vagina has what's called a microbiome. It has a normal environment. It's at the right pH or acidity, which is usually about 4 or 4.6, somewhere in that range, and that means the vagina is normally acidic. Yellow or green discharge actually can be normal. It can be that the discharge is that colour, but you don't have a pathological cause for it. But yellow, especially dark yellow or green discharge, can indicate infection, and that may mean having a test done, which is sent to a laboratory to see if there are any germs that shouldn't be in the discharge. Whenever you have a discharge that is an abnormal colour, such as dark yellow or green, whenever it is blood stained, or if you have associated symptoms such as irritation, itch, burning, pelvic pain, pain with intercourse, is also often an indication that something's not right, and you should be examined and you should have the appropriate tests done to find why you're having an abnormal discharge. If you have an abnormal discharge and it's due to an infection, then that infection needs to be treated with the appropriate medication. If there's any indication at all there could be a more serious cause for this discharge, then you may need to have an ultrasound or imaging of your pelvis. You definitely need to be thoroughly examined, and sometimes further, more sophisticated tests may be indicated if there's any chance at all that this could be due to a pre-malignancy or a malignancy. The problem of ignoring a discharge is that you may be ignoring a serious condition. The other thing is that sometimes symptoms can become chronic. So your pelvic pain, your irritation may become a long-term problem if you ignore the symptoms and don't seek help. If you're not sure about your discharge, if you feel that things have changed for you, and especially if you have pain, you really need to go and see your local doctor and, if necessary, be referred on to a specialist gynaecologist.